Now in this video we see the anatomy of the stomach. So this is the specimen of stomach, and this is located in the epigastric, the left hypochondric and the part of umbilical regions, and this is the specimen of stomach. Then the shape of the stomach is capital J shape. Normal capacity of the stomach in case of children it is only 30 ml, and in case of adults it is 1 to 1.5 liters. Now the external features of the stomach, this includes the two orifices. First is the cardiac orifice, so this is the cardiac orifice, and this is the pyloric orifice. So this is the pyloric end and this is the cardiac end. Cardiac end is the upper end of the stomach, it is continuous above with the esophagus, and the pyloric end, this is the lower end of the stomach and it is continuous with the duodenum, first part of duodenum. Then it has two curvatures. This is the lesser curvature, which is smaller, and this is the greater curvature, which is larger. It is convex and lesser curvature is concave. It has two surfaces. This is the anterior surface, anterior-superior surface, and this is the posterior-inferior surface of the stomach. Now the parts of stomach. The parts are the cardiac part. This is the cardiac part of the stomach, which is close to the cardiac end of the stomach, and this is the fundic part, this dome-shaped part of the stomach. This is the fundus. This fundus can be demarcated by drawing a horizontal plane at the level of the cardiac orifice. So this horizontal plane, the area above it is known as the fundus of stomach, which is normally filled with gas. Then we have the body of stomach. Below this plane, this is the body of stomach, extending up to the plane which is passing through the this notch. This is notch is known as sulcus incisura angularis. This notch is known as incisura angularis, and from this point we draw a tangent which is intersecting at the greater curvature. So from this horizontal plane up to this tangent, this area of the stomach is known as body of stomach. Then the part which is beyond this plane, that is beyond this sulcus incisura angularis, this area is known as the pyloric part of the stomach. This pyloric part of stomach has been divided further again into pyloric antrum and pyloric canal. Pyloric antrum is 7.5 centimeters long and pyloric canal is 2.5 centimeters long. This lesser curvature gives attachment to the lesser omentum. This is the peritoneal fold. This is the lesser omentum containing the branches from celiac trunk, that is your left gastric and the right gastric arteries, and this greater curvature gives attachment to the greater omentum. This is the greater omentum, and it is containing the branches of right gastroepiploic and left gastroepiploic branches. Then now we come to the interior of the stomach. To the interior of the stomach, when we open this stomach, after cutting it along the greater curvature, we see the interior of the stomach. In the interior we can see these mucosal folds. These mucosal folds are known as gastric rugulae. These gastric rugulae are temporary in nature. After filling the stomach they will vanish out, and these mucosal folds along the lesser curvature. So here we see the lesser curvature. The mucosal folds along this lesser curvature, this longitudinal mucosal fold is known as gastric canal. So when we drink or eat anything, it will first come in contact with this gastric canal. So this is spoiled first after eating or drinking any harsh liquid or hard substance. So this will first causing damage to this mucosal layer, and it will. This is the reason why gastric ulcers are commonly affecting your gastric canal region. This is because of this. Because any substance we eat or drink, this first comes in contact with this gastric canal. So beneath the mucosa we will have the submucosa, which is containing your nerve plexus and blood vessels, and below the submucosa we will have the muscle layer. This is the muscular coat. It is composed of the innermost oblique layer, then middle circular and outer longitudinal layer. So this is the muscular arrangement in the mucosal layer of the muscular layer of the stomach, and after this we have the serosa, which is the outermost peritoneal covering of the stomach. Then here we can see the smaller openings in the stomach, which are which are known as gastric pits. So these gastric pits are the openings for the gastric glands, which are the major glands of the stomach. So this is lying in the interior of the stomach. Then this is the pyloric sphincter, which is controlling the gastric contents by passing from the stomach into the duodenum. This pyloric sphincter is formed by the reduplication of the circular muscle fibers lying within the pyloric part of the stomach. So these are the specimens of the stomach. The stomach is supplied by the branches of the celiac trunk, and the venous drainage is in the portal vein. And this is all about the anatomy of stomach. Thanks for watching.